Hi guys, it's Dr. Galante. When patients come in for care, they basically have 4 questions, whether they realize it or not. Question is, what is my problem? Can you help me? How long is it going to take? And what's it going to cost? Those are the 4 questions, whether patients realize it or not, that they have when they go see a doctor and they come to our office. So in this video, we're going to concentrate on the how long does it take part of that, the 3rd question. Now, the short answer for that is it can range anywhere from 0 visits, because if I evaluate a patient and I can't help them, or their problem is better served elsewhere, we refer them out to someone who can help them better or faster than we can. So sometimes we don't treat a patient at all. And it can also range to the other end where people need care for a lifetime to control and manage a condition. So we're going to narrow it down for you for what we call an initial treatment plan. When you come in with a problem, how long is it going to take to get that problem under control? So if you can imagine this line is optimal health. Your body not only feeling good, but your body functioning at 100%. You have a normal BMI, normal body weight. You're not taking a lot of prescription medications. Your diet's real good. You're exercising. Your health is what we would call good. Now, what happens with stresses in our lives, with bending, lifting, twisting, sitting, being at the computer, sleeping in funny positions, we beat ourselves up over time with small everyday things as well as big things like traumas and accidents and moving and lifting and things along those lines. So what happens is our spine starts to go out of alignment and go out of adjustment until we cross this line, which is the pain line. So people don't realize it when their spine goes out of adjustment because there's no symptoms. Very similar to the beginning part of heart disease. There's no symptoms in the beginning. Until they wake up one morning and they can't move, or they bend over into the dishwasher and can't get back up, or they lift that laundry basket and they have severe pain, which happens on a daily basis. So people come in, they're down here in pain. So what we do is we put together a treatment plan for them, and we get them through our program, we make our adjustments, we do our Cox technique, our decompression, and we want to get up above this line. The first thing we want to do is we want to get people out of pain. That's why they come here. But what do you think would happen if we get people out of pain and then treatment stops? Well, it's going to come back. How do I know? Studies show that back pain has a 60% recurrence rate within 1 year and a 94% recurrence rate within 4 years. So once you injure your back, it could be a chronic problem. And that's what we want to prevent from every patient that comes in here, is we want to prevent them from becoming a chronic pain patient. So what we do is we want to do our treatment plan, and we want to get you up here and get you as close to optimal health as we can. And then once we get you up there, we want to keep you up there. Now, this time frame for adults is right around 90 days. If you ever sprained a ligament, if you ever sprained an ankle pretty good, if you ever sprained a knee ligament, if you ever tore cartilage in your knee, if you ever sprained your shoulder, you know it takes about 90 days for those tissues to heal before they're really good and strong. And the spine is the same way, because all up and down the spine, we have muscles and ligaments and fascia and soft tissues that need to be retrained and re-educated. And we have to teach the spine how to work in a proper fashion again. We also have the disc, which this is the cartilaginous part of the disc, and this is the fluid-like part of the disc. And right behind the disc is the nerve that gets irritated when we have sciatica and arm pain, leg pain, and numbness. So we do our decompression, and we do our adjustments, and that gets the pressure off the nerve, gets the pressure off the disc, and starts healing that soft tissue. But to get really at 100%, it takes about 90 days, for most cases, give or take. So we make it easy for you to find out if we can help you or not. And we do that by offering a consultation at no charge. So when you come in, we can sit down, we can talk, and we can see if it's something we can help with, if it's a problem that I treat on a regular basis. I've treated hundreds of different conditions in my 30 years of being a chiropractic physician. If we can help, we'll proceed with an examination, and we'll get any imaging, do any workup we need to do, and then we'll figure out what the problem is, what's it going to take, how long is it going to take, and what it's going to cost. You'll know all that before we start treatment. So if you or a loved one are suffering, take advantage of our complimentary consultation. Let's find out if we can improve the quality of your life. Thank you, and be well.